programs from kids in need are shutting down. But investigative reporter Kirsten Swanson discovered the problem is worse than even the state realizes.
A critical care system in crisis.
The demand is extremely high right now.
You can see the desperation.
From patients to providers.
We're seeing increased waiting lists, full service lines closing down.
But does Minnesota know who's open and ready to help?
The number you have dialed is not in service.
There are active programs in your system.
Again, I can't comment on the specifics.
It's hard to see what's happening from the outside at Options Family and Behavior Services in Burnsville. There are cars in the parking lot and signs pointing patients to the entrance.
So we got some art.
But inside the secure facility,
The kids are doing very intensive stuff here.
there are signs of troubled times.
Oh, yeah.
Once a vibrant space where colorful art covered the walls, the last remaining sign of life is a final farewell, written in dry erase marker.
It's kind of like being at a 2-week-long or 4-week-long wake or funeral, where it's always just goodbye, goodbye, goodbye.
Brian Salmon opened Options 2 decades ago. The intensive day treatment program serves adolescents struggling with mental health and substance use disorders.
This is the group of kids who, if they don't get this, are back in the hospital, are suicidal, are running the streets, all kinds of stuff.
It's an issue we've been covering for more than a year.
I have seen that this need has been growing for years, but it has become exponential.
Kids are struggling.
It's really hard to find therapeutic staff right now.
These children sit in our emergency rooms with no places to go.
There's not enough of anything.
This has been a really vicious couple of years.
In June, Salmon announced the closure of 2 Options clinics in Burnsville and Roseville.
Hiring was somewhat of a problem a few years ago, but now hiring for these positions is nearly impossible.
Because programs like this are reimbursed by insurance, Salmon says he's capped at what he can pay his staff.
So the wages we pay to our staff have gone up 30% in the last 2 years.
But lawmakers only approved a 3% increase this year.
It's unaffordable at this point.
We can't afford to keep these services available anymore.
Ginley Palin is executive director of the Minnesota Association of Community Mental Health Programs. The organization represents dozens of providers across the state.
The pace at which we are hearing from providers and providers are sharing with their colleagues that agencies are closing down has rapidly quickened.
Do you at any given time have an idea of which programs are open and operating and which are not?
So we have an active license list that is something we track in real time.
Eric Grumdahl, assistant commissioner at the Department of Human Services, says there are 441 active licensed programs. But in September, when we checked more than 260 locations on that list,
I'm working on a story about.
We found phones that didn't work.
Is not in service.
Abandoned locations.
The offices are cleared out, everything is dark.
And providers who confirmed they'd shut down weeks ago. Providers like Brian Salmon.
People are just literally saying done and walking out the door.
5 Investigates identified at least 15 programs on DHS lists that were not operating.
It appears there's no business going on at all.
So the specifics of an individual license and what's happening with that particular license isn't something that I can speak to. But what I can tell you is that, again, with 441 actively licensed programs right now in Minnesota, there's a lot of programs that are operating and serving Minnesotans every day.
But do you actually know that number is what I'm asking? Because I just told you that there are active programs in your system.
Again, I can't comment on the specifics of a specific organization's license.
DHS says service providers are not required by law to report when they shut down. But it appears nobody at the state's largest agency is doing what we did.
We are working on a story about it.
Is there a manager that I could speak with?
Confirming that providers on this list are actually providing help.
We are in communication with providers across the state all the time.
When you say you're in contact with them, what does that look like? Is that DHS employees doing spot checks at these different businesses?
So there's a variety of venues and forums and ways in which the agency is connected to providers. There are large associations of organizations that are hearing from and connected to the experience of providers all across the state that we are connected to as well.
Is there a better way to figure out how DHS can learn a point in time count of who is operating and who is not? Because as I said, we have found examples in your own data of programs that are not operating, appear to not be operating.
So again, there's some technicalities around the licensing that I'm really probably not the best person at the agency to speak to. What I'll say is that, again, we know that the programs that are not currently active in a license represents a very small number relative to the total number of programs that are operating.
We can't afford that as a system.
But Palin worries that any reduction in programs will fundamentally hurt the entire system.
If that safety net falls apart, we don't have a backup plan.
We have 2 staff with 12 kids.
Shutting down was never part of Salmon's plan or backup plan.
In your 27 years doing this, did you ever think you'd be at a point like this?
Nope. At some point, the retirement would come up. Find another provider like myself who'd want to take it over and move it on to them.
But that future is gone. The building that saw hundreds of kids come and go through the years now sits empty. A for sale sign posted in the grass.
In 2 or 3 years, if more of our programs like ours go away, people will be sitting back going, well, why don't we have those? And they can replay this newscast and hear some ideas of why it is.
We checked again today, and both options locations that Brian ran are still in DHS database, in that active database.
You think more state funding would have made a difference in this whole problem?
Well, the providers and folks that represent them say yes, absolutely. If those reimbursement rates were elevated more, they would be able to incentivize people to come work in these jobs. There's a critical crisis right now in this industry, though. They're really struggling to get people into these jobs, and also people who are training to go into these jobs. That number is a lot less than it used to be also. So getting people into this line of work and then paying them adequately for the work that they're doing, because it's really, really difficult work. Like you said, these kids are in need of intense mental health and substance use disorder treatment.
And now they and their families are paying the price.
Yeah.
Kirsten Swanson.